The topic is sample collection and testing guidelines. The first point is people, those who are falling on sick like fever and cold, when we will collect the blood samples and other respiratory samples like oropharyngeal and nasal swab, when we will collect from them for testing those samples, those collected blood samples and respiratory samples of COVID 19, in order to test COVID 19, and those who are going for collecting the samples, they need to follow certain rules. Like from the suspected patients, when they will collect those samples, they have to use masks and other gloves and other precautionary measures in order to protect the COVID 19 spread. And also, the room or the lab which they are doing the testing of the collected blood samples and other respiratory samples, the room should be with full of quality, and there should be a special room for collecting those samples in order to avoid the COVID-19 spread. So the room should be with very special measures for testing the COVID-19 samples carefully. This is what first point says. The second point is the laboratories may go to the houses to collect the samples from the suspected people of COVID 19, and this collection process will help to avoid the local travel and to contact the people with suspect cases of the COVID 19. Point 3 is for COVID 19 PCR test and antigen or antibody test are not recommended. The fourth point is the kit, which includes different medicines, syringe, mask, gloves, etc., for conducting PCR diagnosis in the laboratory, which need to get the approval of US FDA certification or European CE certification for the kit to perform the COVID-19 testing. During the emergency situation of COVID spread, we need to get the prior approval from DCGI under Ministry of Health and Family Welfare for conducting COVID-19 test. The kits and the other reagents should be of standard quality. This is what fourth line says. The fifth point is all the laboratory staff, those who are involved in PCR COVID-19 testing, must have appropriately trained. Point number 6. The biomedical waste such as injection, cotton, mask, gloves, tubes, tablets, etc., when we will throw, we need to throw carefully by following the rules of national guidance rules of biomedical waste. The website ID is given below. Point number 7. The collected blood sample and other respiratory sample has to be kept in a protected room which is known as Biosafety Cabinet Class 2 A2. After testing the sample, it should be discarded in a biohazard bag which containing 2% of Lysol or 5% of hypochlorite solution. And after packing the bag, we should not dispose it just like that, where we need to carefully paste the bag and it has to be disposed by following the rules of national guidance. In the national guidance, they have mentioned how to dispose the waste in a different colored dustbin. The waste such as the blood samples, medicines and other food items, how to dispose, which is given in the national guidance, which we need to follow while disposing the samples. This is what given in 7th point. Point number 8. Wherever the suspect patients are there, the laboratory people will go to their house to collect their sample and they will collect the current address based government ID proof such as Aadhaar or voter ID during the sample collection.